So looking at the future, patient-reported outcomes are going to have a much, much bigger role in how we all practice. How are the registries going to incorporate the PROM data?
So it's a little bit different in hip and knee versus spine. In spine, it is and has been for a long time the currency, right? And it comes back to the fact that the assumption by patients, by payers, by surgeons is if you have a hip replacement, it's basically going to be a good operation, right? And most people see improvement, whereas in spine, there's a lot of variability. So patient-reported outcomes have been the currency of measuring that for a significant period of time, and that's probably the registry that's further along from a percent-wise in terms of collecting that data. I think that will change with the government requirement in hips and knees for PROMS data. But in all honesty, I think there's a significant possibility that governmental effort will fail because the mandate is on the hospitals, right? The hospitals are required to report it, but the data collection is largely at the physician private practice level, right? And it's very hard to mandate the hospital collect something a year out when the patient isn't interacting with the hospital. So I think there's a really outstanding question of how scalable that will be and whether they will in fact be able to do it through the process they're utilizing. I think it would be much better to be collected by the registries, by physicians who have the ability to and experience with interpreting that. And I think it's important that the registries continue to incorporate that data. And I think that the government mandates will probably energize that a bit. But in the end, I think that it may fall back that the registries are where that data is most usefully applied. I think that the governmental programs are going to have a really hard time enforcing the mandates that they've set up.